Welcome to Nursing with Binodsir YouTube channel. Today we will discuss Pulmonary edema. Topic-wise MCQ. MCQ with explanation. Topic number: threatening condition that occurs when too much fluid builds up in the lungs, making it difficult to breathe. A. Pulmonary edema. B. Pulmonary congestion. C. Both of the above. D. None of the above. The correct answer is C option. What is pulmonary edema? A. Accumulation of fluid in the lower extremities. B. Accumulation of fluid in the lungs. C. Accumulation of fluid in the heart. D. Accumulation of fluid in the kidneys. The correct answer is B option. Explanation: Pulmonary edema is a condition characterized by the accumulation of excess fluid in the alveoli and interstitial spaces of the lungs. This fluid buildup interferes with normal gas exchange, leading to symptoms such as shortness of breath, coughing, often with frothy or pink-tinged sputum, and difficulty breathing, especially when lying down. It can be caused by heart failure, acute respiratory distress, or other conditions that affect the heart or lung. Which of the following is known as wet lung? A. Pneumothorax. B. Pulmonary edema. C. Hemothorax. D. None of the above. The correct answer is B option. Explanation: Pneumothorax occurs when air enters the pleural space, the area between the lung and chest wall, causing the lung to collapse partially or completely. Hemothorax refers to the accumulation of blood in the pleural space, which can compress the lung and reduce. Which of the following best describe why diuretics are used to treat pulmonary edema? A. They increase the force of heart contractions. B. They remove excess fluid from the body. C. They have a direct effect on gas exchange in the lungs. D. They decrease the permeability of the alveolar membrane. The correct answer is B option. Explanation: Diuretics, such as furosemide, Lasix, are used to treat pulmonary edema because they help reduce fluid overload by increasing urine. When thinking about the anatomy of the lungs, what component is primarily involved with pulmonary edema? A. Bronchi. B. Alveoli. C. Bronchioles. D. Trachea. The correct answer is B option. Explanation: Pulmonary edema primarily involves the alveoli, which are the small air sacs in the lungs where gas exchange occurs. In this condition, fluid accumulates in the alveoli, impairing the exchange of oxygen and carbon dioxide. This leads to symptoms such as shortness of breath and reduced oxygen levels in the blood. Blood-tinged foamy and frothy sputum is a characteristic features of A. Pleural effusion. B. Pulmonary stenosis. C. Pericarditis. D. Pulmonary edema. The correct answer is D option. Explanation: Blood-tinged, foamy, and frothy sputum is a hallmark characteristic of pulmonary edema. This occurs because fluid leaks into the alveoli and mixes with air, creating the frothy appearance. The pink or blood-tinged color results from capillary damage or increased pressure in the pulmonary vessels, causing blood to leak into the alveoli. What measurement can best be used to monitor the respiratory status of a patient with pulmonary edema? A. ABG analysis. B. Pulse oximetry. C. Lung sounds. D. Skin color assessment. The correct answer is A option. Explanation: Arterial blood gas, ABG, analysis is the most accurate and reliable way to monitor the respiratory status of a patient with pulmonary edema. It provides critical information about oxygenation. PAO measures how well oxygen is being transferred into the blood. Carbon dioxide levels. PASIO indicates how well the lungs are removing CO. pH levels determines if the patient is in respiratory or metabolic acidosis alkalosis. ABG analysis helps guide treatment decisions, especially in severe cases where oxygenation or ventilation is compromised. Which of the following position would be the best aid breathing for a patient with acute pulmonary edema? A. Lying flat in bed. B. Left side lying position. C. High Fowler's position. D. Semi-Fowler's position. The correct answer is C option. Explanation: High Fowler's position, sitting upright at a 60 to 90 degree angle, is the best position to aid breathing in a patient with acute pulmonary edema. This position: A. Promotes lung expansion, helps improve oxygenation by reducing pressure on the diaphragm. B. Decreases venous return to the heart, reduces the workload on the heart and alleviates pulmonary congestion. C. Facilitates drainage of fluid. By positioning the upper body upright, fluid is less likely to accumulate in the lungs. A nurse is explaining the concept of pulmonary edema to a client. Which description best characterizes pulmonary edema? A. A bacterial lung infection. B. An inflammation of the pleura. C. Accumulation of excess fluid in the lungs. D. A blockage in the coronary arteries. The correct answer is C option. Pulmonary edema is characterized by the accumulation of excess fluid in the lungs, specifically in the alveoli and interstitial spaces. This leads to impaired gas exchange and symptoms such as shortness of breath, coughing, and, in severe cases, frothy sputum. Thank you very much for staying in touch with Nursing with Binodsir YouTube channel. For MCQ, subscribe the channel, like and share.